what we're going to talk about is how we do a practical application of these in the real world setting, and really where they're focused, what they're looking, and why they're looking at some of these things. We'll look at this in certainly that light, why they come, what they would certainly want to know, and who they'd want to talk to. So this Compliance Program Guidance Manual, as we said, we're going to talk about new regulatory requirements and new, in the FDA's, timeline in terms of being new, but some of the changes that we see in, registration, and there's a lot of focus on registration. We'll talk about that. Registration of your trial and the results, informed consent, your IRBs, that sort of thing, the focus. And really a lot of this, as we can see, are the findings that the FDA has when they're doing their inspections, both domestic and international, and how they are turning their focus particularly on those areas. Unfortunately, I suppose, they haven't changed much over the years. We have the same top 5 findings. They just kind of rearranged themselves. And that's also what we see not only here in the States, but in the EU and, with MHRA and EMA and Health Canada, and a lot of those other areas are seeing the same thing. So if we can focus on those systems, have processes in place to help support those, and really what we'll pull out of this too, as I'm sure you know from reading this, that there are about 20 SOPs that the FDA wants to see when they come and look at you or your vendors. So even though it's not a regulatory requirement to have those in place, they're looking for them. So we'll look at those regulatory requirements. We're going to look at the Compliance Program Guidance Manual as a whole and talk about some of those changes in inspection focus, look at the application of the contents of that inspection manual and what we're seeing in warning letters, as well as steps for preparing for an inspection.